we can reach more people like this. Stéphane, who is the Nogier part, I am the Godthjælp part, is French and teaches also from France. And yeah, so what do we teach? We teach auriculotherapy and auricular medicine, or advanced auriculotherapy as we also call it, and posturology and chromotherapy. All right. So today I want to talk a little about the difference between treating acute and chronic pain and how we manage that in auriculotherapy. So there is a difference of how the body experiences acute and chronic pain. So I could correct myself in saying it's not actually the body that experiences, but the brain. So the pain that we feel is expressed in the brain. And when we have an acute situation, it is expressed in the somatotopy in the brain. And when it's a chronic situation, it will move in the brain. So the expression will move in the brain. The active zones in the brain will differ from when it's acute. And hence we also treat in different ways. So today I'm going to present 2 case stories for you, one with Nicholas, who has acute lower back pain, and one with Caroline, who has chronic neck pain. And these are both very normal cases from what I get here in my clinic. And so we get both acute and chronic pain, and their stories are very common, and very common in the way that I treat often. All right. So when we treat chronic and acute pain, I can see that I started on another slide in my mind. So when we treat a chronic and acute pain, it's different in the brain. So the somatotopy is an area here where where everything is reflected on our body. So somatotopy is a mapping of the body. So you have direct access to the arm or the lower back or the leg and so on. It will be reflected on the brain. And this is, if you work with UNSA or any kind of other scalp acupuncture, you will use this area of the side of the head, because this is directly linked to where we have the somatotopy. So it's very direct. Also, when we have a pain that we feel, like if I have a pain on my hand, like if I slap my hand like this, it will, the pain will walk from where I slap it, and the nerve information will go along the arm and up into my my spine, through my brainstem, and going into the limbic area to the thalamus, and proceeding up towards the somatotopy area. If I have a pain that's chronic, something happens, something changes, because we have to start using coping mechanisms. So when we have a chronic pain, it will change the expression in the brain, or the brain area that will represent the pain or express the pain will be different. It will also be the somatotopy area, but more so also the limbic area. So if I touch my skin, and now you can't see me, but if I touch my skin like on my hand, and it goes all the way through, it goes the same way on my arm to my spinal cord, all the way up to my brainstem, to my limbic area. And then from the thalamus area, the information will go more towards the rest of the limbic area, like to the hypothalamus area. So it will be in another area. It will not be in hypothalamus, it will go around in the limbic area. So it will be represented differently. And this is why we have to treat a chronic and an acute pain differently. Yeah. All right. So the first case study is Nicholas. He has an acute lower back pain. When he comes, he's already had pain for 3 days, and he has been trying to get rid of this pain, or to treat this pain by over-the-counter medicine. And so in Denmark, we use a lot of Panodil and ibuprofen, and we combine that. So many people will take that, and this you can buy on any street corner here in Copenhagen and in Denmark. So this combination, he had been treating himself with that, and of course just lying down in bed because it was painful, and it was not getting better. Then it was getting a little better, and then back every time he tried to move or do anything. So then he calls me and asks if I have an acute time, and I do, and so I treat him. Let me see here. Yeah, here I explain a little about how we go towards treating, but let me just take the next slide. So I will show you the points on an ear, but first I will talk to you about how I treat. So first, let me go through the slides. I very often find jaw problems. And I don't know if people come to me because they have a jaw problem, or if there are just really many people having jaw tension problems. I think maybe because many people had braces. It was a big thing here in Denmark. There was a lot of dental work when I was a kid, and also what you could say not needed dental work, and this can give jaw tension and many other things, mouth breathing and so on. Also, when I work with tension of the jaw, for me it is very much linked to emotional to emotions, to feelings. So it can be feeling stressed, it can be feeling sad, angry, upset for some reason, anxiety, not adequate. So many different emotions will give us jaw tension. In Danish, we say you bite your teeth and you make it. You just do it. So you'll clench your teeth and then you'll just push on through. So I see a lot of jaw tension here, and when I have any kind of pain, I will always check the jaw and to see if there is a problem. And when I treat the jaw, I will do so in the area of C2 and C3. And I will show you this in a minute. And when I test the jaw area, I work from a point of view of the posture and posturology by Michel Marignan. So many of you probably know him from Canada. I know he was in Canada a few times, and he's not with us anymore. But he was my master, my teacher, my good friend. So I learned a lot of posturology, and I used it a lot. And this is why I use this technique when I treat the jaw. I will treat and search on C2, C3, and I will use the frequency A-30. And very often, if necessary, I will put an ASP needle in the point. Then I will also treat the acute area. No, you know what? I'm gonna see if I can I do that? I think I will need to stop sharing to show you this. Yeah, so here you go. So now I would actually like to show you how I work with oi, I'm dropping everything here. Voila. So when I work with C2, C3, it's in this area. And we have the spine going through all the way here. So this is the spine. And C2, C3, the neck area would be in this area. Then we have the dorsal area, and then we have the lumbar area down here. And C1 would be around here, 2, 3. And so as this is the spine, I will have to put my needle and search on the spine. And I will search with a frequency device. I very often use a device called Premio 40, where I can treat with both color and with both color and frequencies. And when I search for points that are related to posturology, I search with A minus 30. So A minus 30. So let me see here. So the other area I wanted to show you, maybe I can just do like this. Yeah. So the other area I wanted to show you is the lumbar area where I treated this man. And it's these needles, don't mind them. They're actually in the hip and in the knee, but this is the whole lumbar area here. And so when I search in the lumbar area on the spinal cord, not on the spinal cord, but on the spine, on the vertebrae and around the vertebrae, I will search here. Some people also search directly on the sides. I never do that. Like 99% of the time, I wouldn't do that. And I search underneath here, which I use a lot when I have when I have a lumbar pain. And so I would actually use this device. It's called the Blue Palper. And we search only for pain with this device. So when I treated Nicholas, I would search like this. I would use my Blue Palper and search like this. And what I look for is, and this is one of the things you have to be careful with, not to do that because that's actually kind of painful. And I would search underneath here. This is kind of tricky, but you can do it. Search pushing like this. And when you do that, just want to say that when you do that, please be mindful that this can be very painful. So do it gentle and not sliding over the ear, because that is painful. When you use this tool, you will push a bit. There is a feather, I think you call it feather or spring inside. I'm not sure of the English word. So that you have the same pressure all of the time. Sometimes there is so much pain that you don't even need to push down. You just kind of touch the area and then don't go further than that. What we're looking for when we are searching is grimace. So you can see when the person is doing that painful expression. And of course, some people, they don't express their pain. So I will have patients where I'm saying, is there any pain? And they will say, yeah, it's very painful, but it's okay, you do what you have to do. I'm like, yeah, but I need to know. So please tell me when you feel the pain. So some people will not express pain because, I don't know, they're very used to the pain. So it's not something that they think they need to bother the therapist with. All right, so checking out the lumbar area. So I think I treated him around this area. Around this area here on one side. Let me see, I wrote it down. On the back air side area, let's look at that one. So the back area, so here we have the spine, and on the back side, we also have the spine. And on the back side of the ear is represented the muscles. So if I want to relax muscles, I will search on the back side. If I want to work on the muscle pain, I will search on the back side. So I differ from between what we call the major muscles, which are on the back side of the ear, and then we will have like a more nerve kind of pain, like the big muscles that will always be when the pain is like on a wider area. And then we have the more specific pain that is very pointy and very like it can be like a flashlight from time to time, like this electricity, like, and that would be like a nerve impingement, and that I would treat in a different place. And I will just show you where I would do that. So again, muscle here on the back side, and nerve impingement, I would do that on this area all the way down here. And then I would also do that here, but we'll not talk about that one right now. We'll talk about this one. We will get back to the other one on the outer borderline. And then we also have the fascia and the tendoids, I think you call it. Yeah. And I would treat that on the outer borderline of the anthelix. Let me show you. So I would treat that on this area, going here, all around here. And in some books, it will say muscles. But for me, muscles, they are on the backside. This area is more like fascia and, yeah, tendons, yes. So, all right. Oh. All right. So, yeah, I scanned along the anthelix borderline that I just showed you with frequency E, and I found a point related to the lower back. And I treated with frequency E and an ASP needle. So I like to combine frequencies and colors and needles and pressure. And I combine depending on what is needed. I have not written about it in this presentation here, but I very often use the pulse and in the French way. So we call it the VAS or the RAC VAS, the Nogier pulse. It has many different names, but it's all the same. All right. So after I treated Nicholas with these 3 points, so first I released the jaw. Not released, but I relaxed the jaw. I did that with frequencies and with an ASP needle. Then I treated directly on the lower back area using the blue pressure feeler that you could see here that I showed you. And then once I found the most painful point, I put an ASP needle. I just want to say that if a person don't like to leave with needles, you could also put a TCM. I call it a TCM needle, or you know, these regular needles that you normally use in the body. I just don't have a better name for it because it's, to me, both of these needles are normal, so I can't say normal needle. So you could change it for that if the person don't want to leave with a needle in the ear. And then I would do, normally when I put in for acute pain, I would do a strong stimulation. And one thing that I have learned from my many years of working with pain in the ear is that once you, when you want to search with a longer needle in the ear, when you want to treat with a longer needle, when you put the needle in, you kind of go a little forth and back and you search for that point. It's like there is a pushback. There is kind of an obstacle, like it feels like you have to push through something. Be careful it's not your finger. Be careful you don't push through the ear, but there will be, it's like the tissue is more tense, and you have to go to that and just give it a little strong stimulation. All right. So Nicholas doing better already after this treatment, and we agree that he will come back after 3 days. Normally, when I treat pain, for me, I like to take a week between, but this was very acute pain. So when it's very acute, I can see the person again earlier. So we make an agreement to see him 3 days later, and he arrives, and he's almost, it's like, it's good that he comes for a follow-up treatment because there is still a little pain, and when he has to stand up and when he is lying in his bed, sometimes he can feel it a bit, but it's not like he can't work or walk, or it's like, it's almost gone. So what I do is I do a follow-up session. First of all, when I can just, oh no, I can't show you that. When I have a person coming in my clinic that still has ASP needles in their ears, I will take a tweezer, and I will just, and I will show you that when we have the ear out, and I will just take my tweezer out, but I will take a tweezer and I will just grab the needle and just see if it's still bouncy, see if there is still like some juice in that needle. And it's of course not in the needle, but in the way it's attached to the ear. Sometimes they will just kind of fall out, and other times you can feel that there is still some good moments left in that needle, so I'll just leave it alone. All right, so this time, what I'm doing is that I can see that there is still a little pain left. And because of that, and because of the story, the case he tells me and how his life is going, he's a hard worker. I like to check on the prefrontal lobe. And the prefrontal lobe is where we treat clinching. And so if you want to treat clinching, one of the things you do is that you search on the prefrontal lobe. And if you use frequencies, as I do, G plus 30 would be a very good thing to search with for this. And I search with G plus 30, and then I treat with G plus 30. And after on Nicholas, I put in an ASP needle. And this is very much depending on if you have still have the VAS, if you can still feel the pulse, or if you can't. So if there is indeed still VAS after you have been treating with the frequencies, searching with different frequencies and then treating, if there is still VAS, then I will put a needle. If there is no VAS, which means that the point has now been treated completely, then I will not put a needle, which is one of the reasons I am so much in love with auriculotherapy. It's because you can actually ask the body, do you want this needle? Do you want this frequency? Do you want this color? I love the fact that we can speak with the body in this way with the pulse. This is one of my, I think it's amazing. I think it's wonderful. All right, so there is still also a little lumbar straining, and the first time I searched, I found most of the pain was on the right side, and when he came the second time, most of the pain was on the left side. So what I do is that I search with my blue palper, and I just want to pinpoint this. Because a pain is on the right side doesn't mean that you necessarily find the pain point on the right side. 80% of the time you will, 70-80% of the time you will, but also some of the other times you actually find a better point on the opposite side. And I won't go into why this can be, but just for you to search on both sides. So even if you come with a pain on your right hip, please also search on the left, because you might find a point that's even better. And if you don't search, you won't know. I also know that there are some people that like to only treat on one ear, because then you have another ear to sleep on. And for me, I will treat on the ear where it's most efficient. So different approaches, different people, different approaches. All right, so this time the pain was more on the left. Well, first time it was all over the lower back, and this time he felt it most on the left. And that might have been because I treated the right side. I don't know, but there was some pain when I searched with my blue palper on the left ear. So then I treated the left ear. I searched with the blue palper, and I found a place that was very tender, and where I got grimace. And if you have several points where you find grimace, you will treat first, and this is very important. You will treat first the most important point, because once you have treated the most important point, maybe the other points, they will disappear. So even if you have 3 points that all gives grimace, find the most painful one. I will say, so which one is more painful? Is it, and I will press A, is it A or is it B? Is it A or is it B? And then in that way, we find out what point is more painful. And at the end, I will treat that, and then I will recheck the other point to see if it's less painful now or if the pain has disappeared from that area. Let me see, retreating, tick, 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 tick. Yeah. Yes, this was, let me just see here. Oh, yep, we have them right here. So I just want to show you this. So I told you that I would show you how to work on, or how I do work on the outer borderline. And we have the whole nervous, not nervous, but the whole nervous section around the insides between the concha floor and then the antihelix wall. Just a second now. I'll just put this one down a little. And where another place where we can also work with the nervous system is on the spinal cord, which is on the outer borderline on the ear, which I showed you in the beginning, and I will show you again. So this is the glass rod that I use when I want to treat with pressure. So you can search with pressure along here, or you can search with the frequencies or colors. But when you want to work on the spine, it will be from this area, this thick area here where we have around C1, and then it will be all the way up to the Darwin tubercle, this Darwin area here. And so here we have C1, and it's going all the way down to L1. L2. And from L2, the nerves are kind of spreading out on the ear. So most people, they are only taught to use up to around L2, L3. But you can actually sometimes find the nerves going further out, like this, just search on this area. And you will sometimes find pain in those areas. So when you want to search on this area, you will have the motor side, like I told you, on the back. So you would have the nerve section, the spinal cord will be right here on the back, on the side, direct side of the ear. And so the motor side will be from the middle and backwards, and the sensory side will be from the middle and going front. So when you want to work with the muscle and muscle spasms and pain in the muscle area, you will go backwards. So if you have an impinged nerve and it's giving muscle pain, you will go backwards. If you have an impinged nerve that is getting sensorial misinformation, you will go forward. So when Nicholas was here, I ended up the second day he was here, searching on this area, and I will do like this, not to slide if I like it hurts. So I'm gonna try and put my fingers like this, and I will search to the back side like this, and I found a point. I found a point with the blue rod, and then I treated it with the glass rod. I treated it with the glass rod, and I think the reason was because he already had the needles in his ears, and I didn't want to add on more needles. So when we add on, in my opinion, when you add on too many needles, you put too many tasks on the brain and on the body. And if you put too many tasks, then nothing happens. It's like too much homework and then nothing gets done. So for me, it's very important I always say, use a maximum of 5 ASP needles. And before I used to use up to 8 ASP needles, and I do in very specific situations, but I try to stay under 5 ASP needles. So this time I chose to use the glass rod to not put in any more needles, because all of the needles from the first time was still in. And when you use the glass rod, you find where you want to give pressure, and you hold like that, not pushing like super hard, but still giving pressure. And you hold like that for 40 seconds. And then you can just lift and move a little, and you can hold for 40 seconds. So you can kind of take a zone. I told you I would also just show you how to use the tweezer. I would take the needle and I will just pull like this, and I will just see, is it still bouncing? Yes, it's still bouncing. There's still some juice in here. Oh, well, I bounced it a little too much. Oop. But that's how I just check it to see if there is still some, like, is there some, I don't know what you call it, pull in this needle. And if it just goes out, then I'll just, of course, take it out. All right, let me see if this is the case. Yeah, after the last treatment, Nicholas was pain-free, and I sent him home pain-free. So that was really nice. All right, I will go through, I can see that I have always so much to say and to share. I will go through Caroline's case a little faster. All right, let me see. Oh, yeah, I put this one in here just to show you that when you have the spinal cord here on the front side of the ear, and you have here the spinal, the vertebra on the back side, and you have the vertebra on the front side. This is a way to search the whole body. You know, if you have this Metamer map, you can see this is C1, C2, C3, C4, and so on. And here you have, and I know it's upside down, C3, C4, T2, T3, and so on forward. So if you have pain in some of these areas, then you can use the map, say, okay, I have pain on this area on the side of the leg here, and you can find the lumbar area, and then you can find the lumbar area here. All right, so this is do-it-yourself treatment. If you are not a therapist that works with needles, then you do the pressure with your fingers. And you start from the outside of the ear, and then you work your way in towards the center. So you will start on the outer edge here, and then the next step will be going towards the end helix, and then the next step you can actually put your finger on your ear and give pressure if needed on the inside here, and sliding a little down. So this is just a little technique for you guys that don't use needles, or maybe you're a reflexologist or masseuses, or you're just curious and want to be able to do something by yourself. So this is a little technique that we can use. Okay, I will explain this here on the next slide. All right, the last case study is Caroline. She has chronic neck pain, and she is working with computers, but also and she's fit. She's a strong woman. She trains, she works out, and so on. And she has a nice table to work at. She stands up, she sits down, she does all the things that you have to do to feel good on working as in an office setting. Still, she has neck pain, and this is chronic. This has been going on for years. So what you have to remember is that some people say that, oh, chronic is something that starts after 1 year, 2 years, then we can call it chronic. I actually learned that chronic is when it changes in the brain, and it will change in the brain after 6 to 12 weeks. So there are different ways of looking at chronic situations, but now we are talking treatment-wise, and so we will call it chronic after 6 to 12 weeks. All right. So let's see. So when I treated Caroline, she had this neck pain, and I like to give a little space. I like to give a little space to treat between the treatments, when I treat when it's chronic, because when it's chronic, we're in the limbic system, and it moves slower than when it moves in the somatotopy area. So we need to have the whole movement in the whole limbic system, and it's slower, it's emotional. So I gave 5 treatments, and the first 3 treatments I had 2 weeks in between every session, and then the 4th treatment was after 3 weeks, and then 4 weeks. So as soon as I see that there is an improvement and it's getting better, I will make more space in between. Could I do once a week? I could certainly do that, but sometimes it's just if the patient or the client is fine with the time in between, I actually think that it's a good way to treat. And sometimes the pain is just so overwhelming, we have to treat with a shorter interval to give pain relief. But this was not just to give pain relief, it was to kind of get deeper, get to the bottom of why is this keeping being a pain. So I treated the jaw, like I already told you, around C2, C3. And then I treated the jaw on the lobe. And this is, the first one here, C2, C3, this is more of a postural approach, whereas the jaw on the lobe, and I will show you this point, is more of an auricular approach. And then I also treated, I wrote along here, but I treated on the prefrontal lobe. And I will show you these points. But I just want to say one more thing about this, because in this one I also treated first rib syndrome, and I don't think it's on here. No. I treated something called first rib syndrome, and I will show all these three zones at the same time. So when I treat the jaw, no, let me take it from another area. When I treat first rib syndrome, it is when the first rib has is pushing on like where the rib is attached to the vertebra. There is a compression of the stellar ganglion nerve, and that can give so many different symptoms. But this guy, he definitely had a first rib syndrome. And when I treat first rib syndrome, I always wait till the second or third time. I will always treat the jaw first. I used to treat the first rib syndrome straight away when I saw it. But it's often very painful to treat, and very often it's due to jaw tension. So if you work with the jaw tension, then the first rib syndrome will disappear, and then you will have had a more causal treatment already there. So I very rarely, very rarely treat first rib syndrome on the first treatment with auriculotherapy. So I will just show you these places where I do this. So let's see here. So you know this one, C1, C2 is in this area. And then let me just see what we were talking about here. Yeah, then we have the jaw in the lobe. You will follow the scaphoid fossa going down here. And right here you will have a jaw area, a jaw point to find. And I will not use a pressure feeler to find that point because it's in the lobe and this is not a place where we can feel pain. So I would always use electrical point finder to find this point, or I will use the VAS. And then I also treated the prefrontal lobe, which is this area. And I also actually did that on Nicholas. I think I didn't show you, but this is the prefrontal lobe area right here. And this is very good when you want to treat clinching. You have to search in this area. And if you work with frequencies, search with G+30. And if you don't work with frequencies, then search with your electrical point finder or the VAS. And you can treat anyhow you see fit. Also, when I treat, I will give you one of the ways to treat first rib syndrome is to treat, because first rib will be around TH1. So you find the area between TH7, C7 and TH1. And you will treat on the outside, on the inside, and on the back side. So C7, TH1. So that is oh, let me just see here. That's an easy way to treat. Oh, I think I forgot to stop sharing. Or did I? No, good, I'm here. Sorry. So the treatment that I just showed you around the ear, that's an auricular approach to treating first rib syndrome. All right, let me just see here. Okay, another area that's amazing, and I really want to share this one. I have an area that I was looking into this book, and I was talking with Stefan, and we started talking about this whole area in the concha, and I haven't been using that a lot. And well, I started using it for pain around cranial pain going down the neck, and also we have an area for the lumbar area. But for Caroline, I use this area. It's called parasympathetic cranial area. So when you have the child in the ear, this is the head. We have the spine going up here, the legs, the arm, and then we have many organs going down here. But down here, so very close to where we to this area, to the intertracheal bridge here, right here, this area. Actually, this needle could be, it's very low, but in this area we have a parasympathetic cranial area. This is an amazing area for headaches, migraines, neck pain, shooting neck pain going up, and also it can also, we can sometimes find it also when it's going down, but all this kind of neck and head problems. Also, I use the liver zone, and I use laterality work. And because she's using her eyes when she's on the computer, this can mess with her. And of course, we use our eyes all the time. But if you're staring into a computer all day, and we also tend to scroll a bit, and we are looking into a screen a lot in this day of age. So this can mess with your laterality. And just very short on laterality, the right and left hemisphere, they communicate, and they do this via the corpus callosum. And when there is an imbalance between this communication from the right and left hemisphere to one and the other side, we call it laterality issue. And the laterality issue can give many problems, like feeling depressed, feeling anxiety, problems on focusing, sleeping disorders. There are so many things that this laterality problem can give. We also call it a therapeutic blockage. So let me just show you where this O' zone is, because for me, it's amazing to work with that. So the corpus callosum is this whole area, and this area right here, we have what we call the O' zone. You might read some places that they say O' point, but we don't have any points in here. We have zones, and then we find a point in the zone. So that's the O' zone. And just to say, this area here is the liver. Yeah, and I very often find the liver area when I have chronic pain patients. I think it might be a Chinese way of thinking, and I'm also an acupuncturist, so sometimes that one takes over, even if auriculotherapy is actually French, and it's a Western approach. All right, let me see here. Okay. Yes, I will do this very fast, and there are so many things to talk about in auriculotherapy. 1 hour is never enough, but when we search, we have two kinds of points. We find reflex points, and we find functional points, and reflex points are painful points. So when we search on acute, we will very often find points on reflex points. And when we have chronic points, we will also find points on functional points. And functional points, we will need to either use the VAS, the pulse, or we can use this Premio 40 or another, what you call it, electrical device, that a point finder. I love this device. This is my favorite. So yeah, I can recommend this one. So here is a little bit about the blue palper. We only use it to find pain, and we only use it on the body via the ear. So we don't use it directly on the body. We search body points, but on the ear. And when you search for a point, you can also use electrical stimulation. So we have over here the blue palper, where we use to find reflex points, and then here the electrical stimulation, where we can find functional points. And with the electrical detector, we can also stimulate. We can stimulate a point with electricity, and when we do it with this device, it will stimulate the frequencies, the 7 Nogier frequencies, A, B, C, D, E, F, G. So it's not only an electrical stimulation, it's also a frequency device that stimulates with these electrical, that stimulates frequencies with electricity. So when I treat, I have shown you two things that I use or talked about. I use the ASP needles, and I also use the glass rods. And let me see. I also use like frequency devices, but I actually haven't written about them here. I don't know why this material has been jumping, but it has. So these are two tools that you can use to treat. All right, so here it says a little about auriculotherapy and who was the founder. I just want to say I cannot do anything without just honoring Paul Nogier, because he is the reason that I can stand here and share all these good therapy tips and tricks with you and experiences. And he is the founder of Auriculotherapy, and you can read a lot more about him. He found out how the whole body was reflected in the ear, and also the vas. We can do so many things with auriculotherapy. We can treat almost anything, and the things that we can treat, we can support. For example, painful problems, we can treat that. Functional diseases, we can treat that. Support could be cancer, dementia, giving birth, palliative relief, scoliosis, and so on. I treat actually a lot of people for scoliosis, but I need to keep treating them to get them to hold them in a good position. Yeah. This is the whole base of the auriculotherapy. We have the child in the ear, the skeleton, and the back side of the ear. I will not go through that. Also, if you want a free ear that you can print out so that you have something to draw on, if you want to draw in these points, if you revisit this seminar, you can print out a free ear here, and then you can sit and draw in the points so that you have it available for you. If you want to know more about these tools in Canada, you will of course contact OPIS. And if you're outside of Canada, you can contact therapeutic directly, and they will put you in contact with your local distributor. If you want more information on different symptoms and so on, we also do that. But these are not free like this seminar. So I will stop here, and I will say thank you so much. And I know that there are a few questions, and I can unpin myself, so I remove pin. Here we go.
Thanks so much, Rikke. That was great. It's always a great tool, auriculotherapy, especially if you don't have access to the rest of the body for whatever variety of reasons that might be. So this is a great refresher of some of that.
One of the things that are really good, I just want to say that when you say that, I'm just thinking that, for example, in Denmark, we cannot put needles if we're not acupuncturist on the body because of the lungs and the organs and so on. But on the ear, you don't puncture a lung.
Yes, yeah.
It's not dangerous in the same way. And you can also just, you can use pressure and different tools that allows you to work even if you're not a practitioner yourself.
I've often heard like phantom limb, right? Or for religious reasons, if clothing can't be removed, there's so many kind of uses for that. I think that it's really important to kind of revisit this style.
Yeah.
So I wanted to get some of the questions that we had, even from your first case presentation. Somebody had asked, so when you were talking about where the patient feels the pain when you touch the ears with the pen, are you talking about the patient will feel the pain on the body, like on the back, or in the ear?
That's a very good question. And I was actually talking about on the ear. So we're looking for grimace where we push, and then you will feel the pain directly on the ear. But sometimes the patient will also feel but here we're searching for a pain that's big. So here I don't think Nicholas would feel the difference because there is already pain. Sometimes we can search for a pain that's not necessarily there, and we can find the pain point on the ear, and then it will also, like, let's say that it's the foot that sometimes there is pain, and we can also sometimes feel the pain or a tickling, a strange sensation in the foot when activating this point by the blood pressure feeler.
Okay, so either. So that's great. Yeah. And somebody had also asked, can you elaborate on when you were talking about speaking with the body through the pulse?
Yeah, I can. I can certainly do that. I think it's a topic that's it's a huge topic, but I'll try, and so I will try and really keep it simple. So we have a patient and they have a story, and we have a therapist and they have knowledge, and then we have the world and we have this kind of knowledge that we have now, and we know that we always gain new knowledge. So there is, like, you can say that there is kind of a clip, or what you call it, like a valley between the patient and the therapist, where there is a lack of knowledge, something that I'm not sharing as a patient because I don't know it's relevant, or because I don't know it yet, or because I'm too shy to share it, and something that the patient don't know, the practitioner don't know. So when I use the VAS pulse, I can search on the ear, and then I can find what the body tells me, because in my understanding, the body always have the answer. So when you can ask the body, is this interesting? Is this interesting? Would you want treatment here or here or here or here? Then the body can say yes or no by the changement of the pulse, of the VAS pulse. I hope.
Maybe, excuse me, I jumped in. Rikke, you can talk a bit more about what is the VAS?
Oh yeah, well, very short.
A few words, just explaining it.
So the VAS is a reaction of it's a sympathetic, parasympathetic, sympathetic. So it's a sympathetic nervous system reacting. So when you approach light or hand, anything towards your body or to the skin, when a light turns on, when there is a sound, we will all have this VAS reaction. It's a normal. We all do that all day. We have small VAS reactions all the time. But if you point to a point on the ear that is that reflects pathology, the VAS reaction will continue. And the more VAS reactions you have, the deeper the pathology is. So you can ask, do you want me to treat this? And then the body can say yes by 5 VAS. And then I could say, would you rather have me treating this? And then it says, yes, I like to get to treat this by 9 VAS. And then I will know, oh, this one is more relevant because it has 9 VAS than this one that has 5 VAS reactions. And a VAS reaction is a
tool. Okay, so this is then using a tool to measure that.
No, that's my thumb.
Oh, that's your thumb.
That's my thumb.
Okay.
I will measure this by pulse. In Chinese medicine, we measure like this. And in auricular medicine, we measure like this. And so it's different than what we're looking for in a Chinese medicine, where we're looking for the depth, and if it's cloudy, and if there's phlegm, and if it's like a string or whatever. Here we're searching if there is a VAS reaction. And the VAS reaction is like you have a pulse. And then when you have a VAS reaction, it's kind of the same pulse, but it's just stronger. So poof, suddenly it's like poof. And then you take your tool away that you're searching with, and it will just be poof, poof. And then you point to the same point, and we're like, the pulse will not change number of beats per minute, but change the expression.
So when you say, for example, VAS 9 or VAS 3, that's the level of expression that you're talking about?
That's a good question. Thank you. And this is just because I use this all the time. So sometimes it's like, when you have the knowledge, it can be difficult to. So like a VAS expression of 5 would be like 5 VAS, boom, 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 5, and then we'll go back to normal. And if I take my tool away and approach it again, I will again to the same point get 5 reactions, because that is the pathology level that point is at. Then another point could have another level that would be 9 VAS, and I would approach my tool, and I will keep my tool here. I would not use this, but I would just approach my tool. I would keep my tool here, and I will keep my tool here until I can feel the VAS is disappearing. So it's just the pulse.
I see. Okay.
Yeah.
Okay. And somebody was asking, how do you treat patients with pierced ears?
Okay, so not a problem. People that have pierced ears, first of all, there are many different ways. In Denmark, we have a lot of these younger women, especially, they like to have pierced ears all the way up here. If you ask an auricular therapist, most people will say, or most therapists will say, in the center of the lobe. But I don't see that it's a problem treating somebody that has piercings, especially not if you search with an electrical device or if you search with the VAS, because the thing is, when we put a piercing in the ear, it's not like, I don't know what you call it, this hole machine, you know, where you make a hole in a paper and it's disappearing.
Yeah.
It's you have this ice kind of pick that you put in, and it's kind of it takes the skin or the tissue to the sides. So it's not like you're not losing parts of the ear. It's still there. And if you destroy a part of an information path, the path will reemerge in a different area. Just like if we have a stroke, we can and it hits the speaking center, we will train, and the speaking center will then be located somewhere else. And the same happens in the ear. At some point, it doesn't matter. But of course, then how much metal is good to have on the body, and
Right.
that's another.
Do you have to remove the piercings if you're doing the electrical stimulation? Will that affect the stimulation?
That's a good question. Also, I really like that. So like these earrings, I take them out and I change from day to day. So I take them out all the time. So if I have to give a treatment and it's I ask people to take the tool, not the tools, but the jewelry off that goes on and off the body every day. And some people will keep a necklace or a ring or earrings. And the things that are constantly on the body, you will want to keep on the body, because that's kind of a constant expression of how your energetic system also works.
Interesting. Does anyone else have any questions about the case, about Rikke's style?
There are some questions in the chat.
In the chat? Oh.
Yeah, on contraindications. And no?
Well, sorry?
On contraindications.
Oh.
On educations, or what are you saying?
Contraindication.
Contraindication.
Who should not get...
yeah. Good. Contraindications. So contraindications, I will, once I know a woman is pregnant, I will not put in the uterus area. And that would be in this whole area here where we have the genitals. So I would not use that area when I know the woman is pregnant. And if I do, I will be very mindful. I would be mindful of doing that. Any other contraindications? If you are a person that bleeds easily, you can get, we have this disease, and I don't know what it's called. We call it a bleeder, but I'm sure it's not the correct English term, but people that are missing this component in the blood structure that makes them bleed. So of course, that will be a contraindication on putting a needle in the ear, but you could then use the electricity. Are there any other contraindications? No, I don't think so. Can you think about anything, Stephanie?
It depends on what tool you use.
Yes. Also, it depends on the country.
Mm.
Yeah, it depends on the country. And when you say contraindications, I'm thinking more about rules. That there are certain rules that you have to abide by in different countries. Like in Germany, I know you have to do the swab and so on, and in other countries not. But contraindication, yeah, very much also depending on the tool. You're very right about that, Stephanie. Yeah.
And do you use a parasympathetic cranial area for lumbar pain?
Do I use the
parasympathetic cranial area for lumbar pain?
Yeah, that's a good question, because I think that might have been a little confusing in the explanation. No, I use the parasympathetic lumbar area, and can I just show that for a second? Would that be okay? Yeah. So I showed you the parasympathetic cranial area, which is up here, and then the lumbar area is down here. So if you have the head of the child here, the spine and the lower back here, then it's easy to remember, or easier to remember, that the cranial lumbar area is close to the head and the brain, and the cranial parasympathetic zone is closer to the head, and the lumbar parasympathetic zone is closer to the lower back. You will find this in the book of Rikke Godthjælp. It's a super book if you're already experienced. If you're not experienced, it will make you confused. There's no index and so on. It's an old book. But if you are already knowledgeable about auriculotherapy and you know a lot, I really recommend this book. It's an amazing book, but if you're a beginner, please wait. It will confuse you. Just confuse you. Yeah. Yeah.
And I think so. Going back to the VAS system, like the VAS pulse, it's VAS, right?
VAS pulse or RAC pulse. In French, it's RAC, and it's in English, it's VAS. So some people call it RAC-VAS, some people call it Nogier VAS. Yeah.
Somebody was asking, where can they learn about this?
Yeah, we need to do an online tutorial, and it's just to know and understand what is the VAS. And we've been talking about this for the last 2 years, and I think it's going to happen in 25. So
Stay tuned.
So we have, yes, and these yeah. So we will do a VAS tutorial, that's for sure. It's all about time. But there are always many questions about this VAS, because for me, the VAS is one of the most amazing things about auriculotherapy. Of course, also that you can treat the whole body on the ear, but being able to question the body like that is mind-blowing in my opinion.
If I may add, Rikke, because you're not doing the promotion, I will do it for you. Rikke and Stefan from Godthjælp Institute are traveling the world and sharing the knowledge of auriculotherapy, spreading it. So don't hesitate to follow their website and access the emailing so that you receive information about the next courses. So in-person courses in Croatia, Romania, Denmark, also Portugal, and many more. So don't hesitate to just join on there, and so you will be informed of courses and also of the online courses of the, Rikke was saying, Q&A. Every 2 months they do a 1-hour Q&A session, which is basically a small course on a specific topic where you can at the end ask all of your questions. So it's a great way to get to know better auriculotherapy and develop your skills.
Yeah, and I am not sure, I was not sure how much I can share and so on, but if I can share that, I would just say that there are free courses and there are courses that are less expensive, and then we have more expensive courses. So there is a wide variety of courses there. And if you want to know about the tools, like the Premier 20, the Premier 40, the ASP needles and so on, we have free masterclass courses on that. And if you're an English-speaking person, you will, on top, when you go to our website, you press, first of all, press the English language, so everything will be translated in English, but also go to the place where it says English, because then you will only get the English courses. So it will be easy for you to see that. And all our free courses is all the way in the bottom. Yeah, and they're free. And you will get the slides and so on. Yeah.
Yeah, all of Rikke's information will be added to this recording so that you can always go back and double check it if you wanted to reference that.
Yeah.
That's a lot of information, which is wonderful.
Yeah. Can you give the title, please? Oh, Stephanie, could you put in the title of Brico?
Okay. So
of the Rikke Godthjælp book. Could you put
elements of auriculotherapy, we no longer exist in English?
Yeah, the orange book, it exists in English. Yeah, you can still buy it.
Okay, I will look for it then.
I will just. Yeah, I can. If you want me, I can go. Do I have time just to take it and show it?
Sure.
Yeah, cool.
I believe it's elements.
I use it a lot.
Yeah. Elements of auriculotherapy.
Yeah. Yes, like that.
Perfect.
And we have the ISBN number here. So take a screenshot. All right. Good.
I think there's one last question here. Could you show the rib syndrome points again?
Yeah, I could do that. And I can do that. And I will say that it's also in the book that if you are a beginner, I would recommend this book called Auriculotherapy by Raphael Nogier. This is a very beginner book, and he has the first rib syndrome protocol. And I use different protocols, and this is the easiest one. It's not always the most effective one, but this is very easy to show. And it's also about how much time I have. So I will show it again. And you will go on, you will have the spine here, the vertebra on anthelix. And you'll find C7 and TH1. And just where they part, you can put a needle here. And then you can also do the same, put a needle on the inside. And then exactly on the same area, just on the backside on the spine. Boop. So that's a technique that Raphael uses. And you can use the VAS when finding this point. But if there is pain, you could, of course, use the blue palper. If there is no pain, use the point finder to find and locate the point so that you're sure you're in the right place. But between C7, TH1. Yeah.
Thank you very much. That's lots of information. I think that, people were very happy. Are there any other questions before we can let her go? Again, this video gracefully will be available online, so you can go back and there's a lot of information that Rikke presented, so you can go back and watch it again, and obviously reach out to her, or you can look at her courses. But thank you for everyone that attended. We really appreciate it.
So thank you for everyone that attended, and thank you to you for inviting me and making me able to share this passion of mine, my work and my passion. Yeah. So thank you for that, and thank you for everybody that's in here and listening. And your questions are welcome. If you have any questions, please reach out.
Thank you. Bye.